Last October, this was the view I had on a 2-hour drive to a rural health clinic in Masavuka District, Zambia. We were on our way to train health center staff on Program WANA, a mobile health program scaling nationally. About 10 minutes into the training, the nurse, who was alone at the clinic, excused herself to attend to a patient. She returned shortly after to inform us that the baby was convulsing and would need to go to the nearest hospital, a 7-hour walk which the mother was about to embark on. We quickly decided to abort the training and drive the patient to the hospital instead. So why am I telling you this story? Well, it exemplifies the everyday unforeseen barriers that may arise during implementation, and also shines light on the larger challenges we aim to address through global health programs. We were trying to implement a program that targets the delivery of HIV results, but were confronted with the larger systematic issues including lack of skilled health professionals, limited available resources, and an absence of an emergency transport and communication system.
My name is Kira Skolas. As a public health professional, I must obtain the skills and competencies necessary to identifying, analyzing, and addressing these complex issues like the ones I described in my story. However, building these skills is a multi-layered and ongoing process. So I'd like to start from the beginning.
This is my mother, Carol, art therapist, art teacher, and fascinating cook. My father, Wayne, is a landscape designer, but his mind is usually turning up a new invention. And my brother, Stephen, like a classic architect, paper napkins are his medium of choice. My family, they're a creative bunch, so naturally I took up several artistic hobbies of my own. But somewhere along the way, my attention was drawn to public health. Drawing and dancing took the back seat, and I thought my creative side was gone. But I'd later learned that creativity is needed in global health, too. I studied international relations and economics at Boston University. I also studied abroad in Kampala, Uganda, where I interned with PACE. I was monitoring a program called Access to Life, which aimed at scaling up access to family planning, reproductive health, and child survival products. I pursued other global health opportunities at GBC Health and as a research assistant at the Center for Global Health and Development. Recently, I returned from a 6-month practicum in Zambia, where I was the program assistant to 2 mobile health programs at ZCARD, the Zambia Center for Applied Health Research and Development. I worked on Program WANA and a pilot SMS project for Saving Mothers Giving Life. These programs incorporated mobile technology to improve early infant diagnosis of HIV, and also to facilitate communication, referral, and emergency transportation in maternal and newborn care. Zambia laid the foundation for my experience in program implementation, but it was time for me to return to Boston and refine and develop my program management skills. Now I'm paired with this group of fascinating individuals. Working on a team to me is one of the most challenging and fun aspects of program management. We're a diverse group. We come from 5 countries, speak 6 different languages, and have vastly different backgrounds. But together, we're Mishk Consultants. We joined forces on our first assignment to develop a first-year annual work plan to strengthen Malawi's health system. In Zambia, I worked with the district health management teams to develop action plans for scaling Program WANA in their district. This helped me contextualize our first assignment and use tools such as the challenge model in framing our work plan. Our final report to the Malawi Ministry of Health and Population was accompanied by a Gantt chart and a monitoring plan. To achieve 4 main goals, we defined SMART objectives, outlined activities, designated a time frame for completion, and assigned responsible parties. Of course, our first assignment was just a test run for the real solutions we would be developing for our climate organization. Now we consult for farm access, specifically producing deliverables in human resource management, quality improvement, and mHealth for their Mr. Sister mobile health clinic services, which provide primary health care to remote populations in Namibia. Human resource management is key in organizational and program development, and HR managers are really the gatekeepers to the organization. Their role not only shapes the direction of the organization, but also the ability to achieve program goals. To help Farm Access identify a SHEC manager, we first had to understand why they needed to create that role and what that role encompassed, who might be a proper candidate, and what exactly they would be doing for the Mr. Sister clinics. Our team successfully produced a personal profile, job description, salary range and benefits package, job advert, interview checklist and scoring sheet, and an SOP of the recruitment process. QI. What does this mean to us? Well, first it meant defining quality in terms of patient rights. Then, a method for measuring and achieving that goal. We developed a PDSA cycle for continuous improvement and used tools including a current and future process map, SOP for gaining informed consent, and a patient rights monitoring tool. mHealth seems to be all the buzz right now in public health, but we often lose sight of the implementation challenges that are associated with it, with all this excitement. For me, it's hard to forget all the network issues, power issues, tech literacy, uptake, cost, and partnership challenges I faced. Our final product was Voice, an mHealth eHealth patient feedback system which built upon the new mHealth system Pharm Access had in place. We used process maps, simulations, a comprehensive cost estimate, and an M&E plan to showcase our pitch. I particularly enjoyed this project as I was able to exercise leadership skills as the team head in a different setting than I had in Zambia. Plus, I could not be more proud to congratulate my teammates in winning first place in the project pitch competition. So let's go back to the story about the baby in rural Mazabuka. What if this situation occurred here and the drive looked more like this? What has changed? The program management skills and implementation tools we use may remain the same, but our surroundings are different. An emergency transport system most probably exists, and skilled health professionals are readily accessible, and with proper resources. Aside from the rain maybe making the drive a little more difficult, this situation is much easier. It's essential as program managers to contextualize the program's methods and tools we use to reach our objectives. Understanding the people, culture, and history of the places we work in before carrying out an intervention will help us achieve maximum impact and results.
Washed his hands and sealed his face.